A very good day everyone. Today we are discussing the recent protocols of COVID-19 management in India. We will be discussing the mild, moderate and severe categories of COVID, treatment which is not helpful, treatment which will benefit, and lastly, some investigations useful to predict severity. As per Indian SARS-CoV-2 Genomic Consortium, Omicron is now the predominant variant in 95% of the samples studied, with BA.2 in 83% cases and BA.1 in remaining cases. This is a comparison of positive cases, deaths and case fatalities till 27 February 2022 in district of Kolhapur and Sangli with almost similar numbers. These are the national guidelines released in second week of January 2022 by Ministry of Health and Family Welfare. Anticoagulation in severe disease was missing in the severe disease management. These are the state guidelines released in January 2022 by DHS and DMER. In these many categories are combined, creating some confusion and some typing mistakes are also present. We will be focusing on classification and drugs mentioned in these two guidelines. This is the classification of COVID-19 as per severity of disease in national guideline. In mild cases, there are upper respiratory tract symptoms, no breathlessness and saturation remains normal above 94%. In moderate cases, breathlessness with respiratory rate between 24 to 30 and or SpO2 between 90 to 93%. In severe cases, breathlessness with respiratory rate more than 30 and or SpO2 less than 90%. In this slide, we are going to see the drugs whose role in COVID-19 is doubtful or not useful. First, hydroxychloroquine used in the first wave as prophylactic as well as therapeutic drug, as it demonstrated in vitro activity increasing endosomal pH and preventing release of viral RNA from endolysosome. Animal studies as well as human trials both in OPD and hospitalized cases like Solidarity and Petal trial have failed to show a benefit of hydroxychloroquine. Next is antibiotic azithromycin, extensively distributed in both first and second wave, presumed to be working through its anti-inflammatory role but has failed alone or with combination of HCQ to show any benefit. Next, we see the combination of another repurposed anti-helminthic drug, ivermectin, used in second wave with doxycycline with anti-inflammatory action. The dose required to treat in vitro compared to actual dose was very large. Also, Ivercor trial, Argentina and other third world countries demonstrated no benefit. The concept of convalescent plasma was to inhibit viral replication from high titer antibodies obtained from the plasma of recovered COVID-19 cases. Although large trial, recovery trial, REMAP-CAP trial, Concor 1 and Indian Placid trial found no benefit in hospitalized cases of COVID-19. However, when administered early, have produced a small benefit that needs a larger trial to prove. Fluoxamine, a selective serotonin reuptake inhibitor, due to its anti-inflammatory action, was used in COVID. However, data from large trials in Brazil showed that it did not reduce hospitalizations, and also due to the side effects like nausea, compliance was poor, and also the drug had different interactions. Also in the list, some other drugs like lopinavir, ritonavir, povidone iodine gargles, colchicine, casirivimab, imdivimab, monoclonal antibody in Omicron due to increased spike mutations, and antifibrotic drugs like pirfenidone. In adults with mild COVID-19, the principle of treatment remains same: rest, plenty of oral fluids, and adequate nutrition during home isolation. As the Omicron variant has affection for the upper respiratory tract rather than alveoli, patients with sinusitis, bronchitis, asthma, bronchiectasis will be at risk along with those unvaccinated and other organ-related risk factors. Let's review some drugs used in mild COVID-19. Zinc tablets were used in first and second wave state guidelines but removed now. Zinc has in vitro virucidal action and not proven to have any benefit or harm if given at recommended daily allowance. Vitamin C given as supplement presumed to work against COVID by its antioxidant action. In small trials, vitamin C has reduced mortality in sepsis-induced ARDS. However, in COVID, no beneficial role found in many trials. Vitamin D, extraskeletal effects on immunomodulation and also deficiency found in chronic diseases resulted in its use in COVID-19 in first and second wave. However, with no role in mortality reduction, the drug should be at clinicians' discretion to use. Paracetamol as analgesic antipyretic should be used. In Omicron, higher doses are needed initially, and if symptoms not controlled, NSAIDs like naproxen or ibuprofen immediate release can be added for SOS purpose. Antitussive for cough. Only one small study found that honey is as effective as antihistamines or opioids like codeine or dextromethorphan. Favipiravir, a repurposed antiviral drug used for resistant influenza, only included in the state guidelines in third wave also in the doses as described, despite multiple studies showing no efficacy in reducing mortality. Also, the parent company Avigan showing public notice about efficacy in COVID. We request clinician discretion in using this antiviral drug. Molnupiravir causes lethal mutagenesis by inserting RNA-dependent RNA polymerase. It is included in state guidelines but not in national guidelines due to its mutagenic teratogenic cursor. It is indicated only in adults within 5 days of onset of symptom, in patients who have high risk of progression, and when other antivirals are not available. It should be avoided in pregnancy, lactation, and reproductive age group. In trial of molnupiravir, it was not found efficacious as earlier propagated. Also, considering risk-benefit ratio, we request clinicians' discretion in using this antiviral drug. Remdesivir injectable antiviral drug used extensively in first and second wave inhibits RNA-dependent RNA polymerase of SARS-CoV-2. In mild COVID-19, the Pine Tree study of more than 500 patients with risk factor and within 7 days of onset of symptom showed 87% efficacy to avoid hospitalization or death compared to placebo.